I'm Dr. Nadia. I'm a naturopathic doctor, co-author of the PCOS plan, and I've spent more than 20 years helping people better understand metabolic health, hormones, and weight. This podcast is about helping you fight smarter, not harder. It's about looking at symptoms as signs and not judgments. We'll talk about metabolism, menopause, insulin resistance, obesity, PMOS, therapeutic eating, hormones, medications, and the science behind why our bodies do what they do. Because understanding your biology is the first step toward healing. Have you ever noticed how differently we approach infertility compared with metabolic syndrome? When someone's struggling to have a baby, nobody expects one person to solve everything. Nobody expects one treatment to work for everyone, and nobody expects someone to simply try harder. Instead, we build a team. We investigate. We ask questions. We look for every possible contributor. We use every appropriate tool because complex medical conditions deserve thoughtful, collaborative care. And I believe metabolic syndrome deserves exactly the same approach. Now that we're all done with the blame and shame, and you know that metabolic syndrome is not your fault after our discussion in episode 1, now what? You still have to get better, but how? And who's going to help you? This will need to be a team effort. I personally don't consider what I do alternative medicine. I consider it complementary medicine because to me, those words mean very different things. Complementary means working with or alongside. Alternative means instead of. For more than 20 years, I've worked alongside my patients' healthcare teams. They're general practitioners, endocrinologists, gynecologists, psychologists, psychotherapists, trainer, and many other specialists. My role is to use therapeutic eating, lifestyle, and food as medicine to complement conventional care, not compete with it. When appropriate, that may even mean working alongside hormone replacement therapy, metformin, GLP-1 medications, blood pressure medications, antidepressants, and any other treatments. My goal has never been to replace medicine. My goal is to improve your health and support your well-being, improve your overall quality of life, and help people achieve the very best possible outcomes. To me, healthcare isn't about choosing sides. It's about working together because the best care always comes from combining the right tools at the right time for the right person. Nobody wins when healthcare professionals compete with each other. The patient loses. And that's exactly why I call what I do complementary medicine. Now, let me tell you something I feel very strongly about. There's no such thing as totalitarian medicine. Complex medical conditions rarely have a single cause, and they rarely have a single solution. No one expert can do it all. Every healthcare professional should bring something to the table, but nobody is the table. I bring something to the table, but I'm not the table. And if anyone ever tells you that they are the table, that's a big red flag. Medicine has become far too complex for any one person to know everything. That's why we have specialists. That's why we collaborate. That's why the best healthcare teams respect one another's expertise. I'm one member of your team, but not the entire team. Choose your team wisely. And don't be afraid to fire the ones who don't help you or who don't work well with the rest of your team, including if they don't work well with you. If they don't listen to you, if they blame or shame you, if they dismiss your concerns, they're probably not the right fit. I know the word fire sounds harsh, but remember, you're hiring these people to help you. You're allowed to ask questions. You're allowed to expect respect. You're allowed to expect someone who listens. And you're allowed to leave if the relationship isn't helping you. That doesn't necessarily make them a bad healthcare professional. It may simply mean they're not the right healthcare professional for you. I'm known for being a tough coach. I practice tough love. I'm very direct. I don't sugarcoat things. I'm not everyone's cup of tea, but I don't shame people. And I don't blame people for medical conditions that are not their fault. There's a big difference. I don't tell people to try harder. I teach them to fight smarter using all the tools available. Therapeutic eating, better sleep, less stress, building muscle, hormones when appropriate, and medications when appropriate, because they are all tools, not trophies, not failures, just tools. Sometimes I ask myself, why do we approach infertility this way, but not metabolic syndrome? Think about someone struggling to have a baby. We don't immediately jump to IVF. We don't immediately jump to medication either. First, we investigate. We take a history. We order blood work. We look at hormones. We assess ovulation. We evaluate sperm health. We do some imaging. We ask about nutrition, stress, exercise, body weight, underlying medical conditions. We try to understand why, because that's what good medicine does. It looks for causes before assigning blame. And once we have more information, we build a plan. Lifestyle changes, nutrition, stress reduction, better sleep, and sometimes medications like letrozole, sometimes surgery, sometimes IVF. Not because anyone has failed, not because those treatments are shortcuts, but because they're tools. Evidence-based tools designed to help someone achieve the best possible outcome. And nobody judges them for using those tools. Nobody says, if you really wanted a baby, you wouldn't need IVF. That would sound ridiculous. Instead, we celebrate that medicine has options. Now imagine if we approached metabolic syndrome the same way. Instead of telling someone to eat less and move more, we'd investigate. We'd look for insulin resistance. We'd assess blood sugars. We'd evaluate sleep, stress, hormones, menopause, PMOS, nutrition, movement, muscle mass, mental health. We'd optimize every pillar of metabolic health. We would implement therapeutic eating. We would work on sleep. We would address chronic stress. We'd encourage resistance training. And when appropriate, we'd prescribe medication like hormone replacement therapy, metformin, and GLP-1 medications. Not because anyone failed, because they're tools, just like letrozole is a tool for fertility, just like IVF is a tool. The goal isn't to prove that you can do everything naturally. The goal is to become healthier, to lower blood sugars, reduce food noise, improve energy, protect muscle, improve sleep, reduce inflammation, and lower long-term health risks. The goal is to build a body that works better. That's the outcome we're trying to achieve. That's what good medicine should look like. Sometimes people confuse accountability with blame. They're not the same thing. I will absolutely hold you accountable for the things you can control, but I'll never blame you for the biology you can't. That's not coaching. That's judging. And those two are very different things. Another challenge I see every day is conflicting advice. And conflict needs to be resolved. In my experience, when women receive conflicting advice, they become overwhelmed. They become paralyzed. Eventually, they stop doing anything. I can't tell you how many women I've met over the years who came to me completely exhausted. One professional told them to fast. Another told them never to fast. One told them to eat 6 meals a day. Another said only 2. One blamed carbohydrates. Another blamed fat. One blamed menopause. Another blamed stress. One wanted hours of cardio. Another said cardio was useless. Eventually, they weren't sure who to believe anymore, so they stopped. Not because they were lazy, because they were exhausted. In Portuguese, we have a saying, cada macaco no seu galho. It roughly translates to each his own. To me, it means finding the expert in each field that you trust and respect. It doesn't mean every expert agrees with every other expert. It means every expert knows what they bring to the table and they respect what everyone else brings too. For example, if you already have someone helping you with your diet and you're happy in seeing results, stick with them. Following 2 or 3 different nutrition plans at the same time or constantly jumping from one expert to another is likely to cancel out your progress. 1 step forward, 2 steps back. The same thing can happen with exercise. One professional says you need lots of cardio. Another says it's all about resistance training. You try one, then the other, then both. A few weeks later, you're confused, you're exhausted, and you've stopped exercising altogether. Choose one and follow it consistently. Then decide whether it's actually helping you. I've seen the same thing happen with sleep. One expert tells you never to get out of bed if you wake up during the night. Another tells you the best thing to do is get up, read for a while, and only go back to bed when you're sleepy again. You'll go crazy. Choose one. Be consistent. Then evaluate whether it's working. The internet has made information more accessible than ever. Unfortunately, it's also made conflicting opinions more accessible than ever. Everyone has a podcast like this one. Everyone has a YouTube channel. Everyone has an Instagram account. Everyone has an opinion, but not everyone has experience. Not everyone understands your body, and not everyone is talking about you. So who should your healthcare team be? I like using my 5 pillars of metabolic health as a guide. The 3 pillars of therapeutic eating, sleep and stress, and exercise. Right there, you already have several areas that often benefit from different expertise. Someone to help you with eating, someone to help with exercise, and someone to help with sleep and stress. Then, depending on your needs, a few different doctors, a general practitioner, maybe an endocrinologist, a gynecologist, a psychologist, a physiotherapist, perhaps a cardiologist, or another specialist that you need. Not because you're broken, but because complex medical conditions deserve comprehensive care. Now, let me show you what collaborative care can actually look like. I've had patients whose general practitioner managed their blood pressure. Their endocrinologist managed their diabetes. Their gynecologist prescribed their HRT. A psychologist helped them through emotional eating. A trainer helped them build strength and muscle. And I helped them with therapeutic eating and lifestyle. Nobody was competing. Nobody needed to be the hero. Everybody had a role, and everybody stayed in their lane. And the patient won. That's what complementary medicine looks like. Now, you might be thinking, this sounds like a lot of work, or this sounds expensive. And yes, building the right healthcare team does take some effort. But remember the saying, it takes a village. I think that's true in healthcare too. Not everyone on your team has to cost you money. Some professionals may be covered by your insurance or your public healthcare system. Some may be worth investing in privately. And some of the best education you'll ever receive may be completely free through books, podcasts, reputable websites, supportive communities. The important thing isn't how much you spend, it's making sure the people around you are actually helping you move forward. Because no one person has all the answers. No one person can do it all. No one person is the table. Find people who each bring something to the table. Build your team. Work with people who respect one another. Thank you for listening. If this episode helped you, please subscribe and share it with someone who might need to hear it. You can find my resources, courses, and more at drnadia.com. Until next time, keep your eye on the ball, fight smarter, not harder.